might seem crazy what I'm about to say. Sunshine, she's here, you can take a break. I'm a hot air balloon that could go to space. With the air, like I don't care, baby, by the way.
Hey, COCA friends, it's top of the hour. Thank you for joining us tonight for our discussion. Glad you're here. Thank you for making the time to be with us. And I'm going to kick it over to Matt Rutler, who is going to help us to moderate our discussion tonight.
Thank you, Jennifer. And yes, welcome everybody. We hope you are excited to join us tonight where we talk about COVID-related questions you need to ask your host camp facility. So whether you own your site or you rent your site, these are questions that we all are thinking about, things that are going through our heads. So we are very fortunate that we have a great panel here with us tonight. But if you could do so, be so kind as to change your name, if you could rename yourself with your first name and your camp or organization, that would be great. We'd love to see your faces. So if you want to turn on your video, that's awesome too. And again, this session is approximately 45 minutes. Different from our previous two sessions. This is really going to be based on your questions, what you have to ask and what you'd like to know. So after, of course, we introduce our panelists, we open it up to the floor. So feel free to unmute yourself, ask questions. You can also still put them in the chat if you'd like to, and we'll make sure those questions get asked. And we understand as well and recognize that there are a number of folks on the call that also own their own sites. So if there is a question that is posed and you would like to contribute to that, we highly encourage you to do that as well. So I'd like to introduce our panelists and again, thank them for being with us this evening. We have Ryan Campbell from Happiness is Camping in New Jersey. Giving us a wave. We are joined by Dennis DePaul from Camp Tecumta in Vermont. Hi, Dennis. We have Brian Crater from Camp Ronald McDonald for Good Times in California. And we are also fortunate to be joined today by Colin Leonard from Camp Uchagayas, Camp Trillium in Canada. So thank you guys so much for joining us tonight. We are going to open it up to the four of you to kind of discuss and talk a little bit about what's going on with your sites. And then we will open it up to the rest of the participants for questions, and then we'll get this party started. So at no random order, just the way I wrote everybody's names down, we're going to start with Ryan, if you'd be so kind.
Perfect. Hello, everybody. Thank you all for being here again. So again, my name is Ryan from Happiness is Camping in New Jersey. We own our own facility, and we are planning on operating for two-week sessions of in-person camp this summer. In a normal year, we also rent to about 30 rental groups. Most of those are just day field trips for 5th grade classes. And then we do 4 nonprofits that stay for a week as well. And that runs from May to October. But this year, we're only doing 2 nonprofits that are both coming for a week after our summer camp. Neither of them are medical camps. But yeah, we're doing a condensed summer this year, so we'll be closed by Labor Day this year.
Thank you, Ryan. Dennis?
Hi, everyone. Thanks for being here. We also own our own property, and Camp Tecumta has decided to not run its programs this summer because of the pandemic, and our partnership with the hospital has made it impossible for us to do that because they have told us we are not allowed to operate. So that changes how we think about it, basically, for us. We also rent our property to people year round. We rent our property to different individuals, and the big summer camp programs that happen on our property this coming summer all have also decided to remain virtual and to not rent our space this coming summer. So none of our rentals, some serving children at risk, some serving children not at risk, but from multiple states all over New England, they have decided not to operate in person because they just don't feel like they can meet the requirements, the ACA field guide requirements. So we still have some day rentals that will probably happen that are more small and meetings that happen in our pavilion, things like that. But for the most part, Camp Tecumta's property will be closed for the majority of the year.
Thanks, Dennis. Brian.
Let me get off mute. Hello, everyone. Hello, everyone I know. Hello, everyone I'm just meeting. How are you? Great to see you. Yeah, Brian Crater, Camp Ronald McDonald for Good Times. We're lucky enough to have 60 acres in the mountains right above Palm Springs on the east part of Los Angeles, serving Southern California. Just last week, our organization, in consultation with our medical advisory committee, decided not to operate in person for our summer programs for our oncology camps. We also do partner with a number of different camps, all of which have decided also not to operate for this summer and looking forward to fall. But yet that whole process of working with them to find out what their concerns are, what ours would be, and those kind of things, has been a great process. So we've learned a lot from that, and also looking forward to the end of this tunnel. Hopefully in fall, we'll be able to get back up, if not, definitely in 2022. And so that's a little bit about us.
Thanks, Brian. Colin.
Hi, everyone. Colin Leonard, Camp Ooch and Camp Trillium out of Ontario, Canada. And nice to meet you all. Where we are, we're still working and planning to operate this summer in hopes that the provincial government will agree with us, and that the OCA, the Ontario Camps Association, which accredits camps here in Ontario, is able to lobby and work with them in order to allow us to operate. Our goal is to run family-based programs at 2 of our owned locations, and have those groups come obviously in their bubbles and basically navigate sites in their bubbles, and operate in that way. We also, out of our organization, run community programs and day camp programs out of Toronto, London, and Ottawa. And so we're in not a unique, but we're also in that situation where we are going to be renting properties from others to operate those day camps. So I'm excited to be here tonight, both to sort of learn on that end and hopefully share on the preparedness approach to preparedness that we've taken for our summer program in this upcoming year.
Thanks, Colin. So as I had said previously, we do have a list of questions that we could go through, but we really would love to hear from all of you. What questions do you have for our panelists and for each other in regards to host sites and the camp facilities that we utilize? So if you have a question, please feel free, just unmute yourself and shout it out. Or if you'd like to put it in the chat, one of us will catch it and read it for you as well.
And just maybe as you're thinking and putting your thoughts together, I did want to jump in with what Colin said, because here in California, we are still not permitted to operate. It goes by the United States state as well as our county. So we're watching that and also kind of trying to lobby some of that, but that's for any overnight experience. We do allow day camps in our state, but not overnight camping or retreats or those kind of things.
So while we're waiting for some folks, just to put some questions out to our panelists and anyone else, obviously, who would like to chime in, what are some things that you are taking into account or things that you are looking towards? And we do reference ACA standards quite a bit, but what specifically are you all looking at as if you were going to rent your site to another party, whether it be a day camp or an overnight, excuse me? What sort of things have you looked into? What have you been doing? I mean, I know some of those answers just from my conversations with y'all, but if you'd be so kind as to share some of those protocols that you've put into place.
Take that question first, Matt. So one of the biggest things that ACA and the field guide put out was the need for ventilation everywhere. They want you to be outside as often as possible. So what we've done at Happiness is Camping, what we're going to do for our camp and for our rental groups is we've rented a lot of tents this year, big jumbo catering tents, party tents. So that's going to cover our patio area so that we can eat outdoors. We're going to have one at Arts and Crafts. There's going to be one over our basketball court. So it's going to be like a tented pavilion almost. And then for the cabins, we've gone through and have upgraded all of our HVAC units. So we had to put fresh air intake units on all of our HV units so that we can draw air in and send it back out as well. We installed UV lights, UV disinfectant lights into all of our HVAC units. And we've also cleaned out all the ductwork at camp. So I would say one of the number one things that you're going to want to look for is how are we ventilating buildings and what's our plan for trying to be outside as often as possible.
Yeah, Ryan. In addition to that, I mean, we spent a lot of time just trying to think about with our facility configuration, what was going to be safe distancing and safe groupings, whether or not that's overnight camping. I mean, some of our cabins share restrooms, some of ours are individual. And so in looking at that, we just thought what would be safe if it was going to be, you know, a youth group, if it was going to be a family group, once again, to have that kind of distance in their own space, which is kind of counterintuitive from what we've always done. But it's one of those ways to look at that, and also taking a look at where those activity spaces are and what those look like. Once again, being outside, do we have that ability with heat, with shade, humidity, all those kind of things? What would work, what wouldn't? And also with regards to what activities would actually be manageable from sanitizing in between different program activities. And then not even mentioning who would have responsibilities for those. So, you know, we were just trying to think functionally, how would we move? Where would we stay? What would we do? And we also took a look at the staffing model, because we realized instead of having activity counselors and cabin counselors, we were going to then have staff that would be with that group for the whole week, for the whole day, for the whole experience. And they would have to kind of be that utilitarian player, kind of running some of their own activities. So we weren't having people coming in and out and having that problem with cross-contamination to a lot of different groups. So these were some of the things that we talked about with regards to how we could operate in hope of doing so for the summer, but we thought it was quite manageable.
Yeah, as we sat down to work through our planning for the upcoming summer, the first handful of things that we looked at were sleeping, eating, and washroom use. And then we kind of moved on from there to start looking at, after that, the flow of the site, as well as programming, and then outbreaks, and what do you do in the event that there's a case. But I can tell you a lot of similarities to what I'm hearing so far. And Ryan, we've looking at our HVAC system, we've put in MERV 13 filters, which is not hospital grade. It's not the ones you'd use in your home, but it's apparently an in-between that will help to do the trick. And some of our friend camps in the areas where we're operating are looking at the use of HEPA filters and as well air purifiers in those cabin areas where they don't have good airflow or forced air running through. And then just Brian, on the point that you were making around washroom use, we're lucky in the 2 overnight sites where we're operating, where we can set it up so that each family has their own washroom, inclusive of shower. So we're able to really keep those bubbles tight for the 5 days that they're on site, and disallow folks from entering those bubbles as well during that time, unless it's absolutely necessary.
I'll just add, because we're not operating our site this summer, we haven't done a lot of these types of preparations, with the exception, I think we've considered all of the things that people have said already and have looked at those things as things that we may need to upgrade. We have a new facility. Our facility was all built within the last 10 years or so. So we have the benefit of having very new equipment, and everything is in highly good operating order, which is helpful. The one thing I didn't hear anybody mention that I will mention is kitchen ventilation for us in the cooking space. And we have to follow the Vermont Department of Health's rules related to what they are and how that space will be ventilated in addition to the hood space, and the kitchen quarters or the sleeping quarters if they're spending the night. That's the other area that we're taking a very close look at, is the kitchen, because kitchens can be an easily spreadable disease area. So that is the one add-in that I'll throw in. We've done all the others as well as bathrooms. Each of our cabins have their own bathrooms. It's easy to separate. Common bathrooms we feel we can keep clean well if we need to, in particular for day events. But then we have a very large outdoor pavilion for the majority of our activities, which is very helpful because that's all open air, which is nice.
And Brian, you're muted.
Whoops. So Matt and the crew, I wanted to kind of mention, because I'm looking at the chat, I think one of the things that we have done is because we've had partner camps that we contract with. Some we just provide food service facilities, they take care of programming. Some we actually train, they recruit staff, we train staff, we supervise everything, food service, all that. And so it's a little bit different. It's kind of, you know, people can make their choices on what kind of an experience that they'd like with us. I think we have had some initial conversations that has just been back and forth with regards to what we will actually cover or what our procedures are with a facility, having to do with you know, certain guidelines. And I know, and I don't want to make assumptions, but I know that out there right now, there's, at least in the States, there's not a tremendous amount coming from our state and our county. And so therefore we have the tendency to kind of look to other authorities. And the most research and the most one out there is the American Camp Association with their field guide, where it's pretty detailed. But, and we've even had people refer to that. Hey, what are you doing a part of with regards to these issues? What aren't you doing? What will we need to be responsible for? You know, it's the kind of thing of you know, we haven't had people say, well, we're requiring you to do this if we come to you. At this point, it's kind of a negotiation. And then it's really, you know, from my point, because I have also rented camps. It would be my choice of either we're not comfortable in coming, or okay, that works with you, or here's a sticking spot. It then becomes a negotiation after that.
Great. So there are a number of questions coming in through the chat, so I want to make sure we can get to all of them. So there is a question that was put out earlier that asked about staff expectations as far as when you have your staff come in, you have a group coming in, whether it's lifeguards, etc. You know, what does their interaction look like as far as the groups coming in, your staff interacting with them? Are we requiring masks, etc.? So what would that necessarily look like for your staff interacting with your rental group? Or even your own campers, if you're hosting your site?
So I just wanted to touch on Cindy's question real quick because it relates to the HVAC. We've had to do all of those HVAC upgrades because our units are new. It's actually the older ones are actually better off. Like those window units are like the best air units that you can have right now, as long as they have a filter on them. So a lot of the older camps with the older technology, it's actually a little bit better right now for that. But as far as our staff requirements, we're requiring our staff to wear masks at all times, especially with our rental groups. We can still do archery, no problem, because you can be distanced and do that. We can, we really only do the specialized activities, so we're still going to lifeguard, that's no problem. They will wear masks while they lifeguard as well. Ropes is kind of up in the air. I know a lot of camps that operated in 2020 didn't open their ropes course. We are going to open our ropes course for our summer campers, but as far as rental groups, we might not be able to do the zip line because you have to get in each other's face while you're up there on the platform. But things like the climbing tower, things where you start on the ground, we have triple lock carabiners, so we can have a ropes person standing, 4 feet away watching, and that camper's counselor can clip them on, and it automatically clips them on. So you can perfectly see from 4 feet away if they're connected. That's something that we might have to do on our ropes course just so that we can remain distant. But as long as we can remain distant, we're going to offer the activities for our rental groups.
So Ryan, just to follow up on that, this is Jennifer. We have a ropes course on our campus as well. Are you allowing people to share equipment, or are they like assigned equipment for the week and they have to use that same equipment the whole time? Or how are you doing that? Because I know manufacturer, recommendations would not say sanitize with chemicals on your equipment.
Yeah, so that's a really great question. That's a really hot topic right now
Hot.
too. We are
Hot
probably we're probably going to have them keep their own equipment the entire time, because that's what the ACA says right now. But I was just in a town hall, I think last week or the week before, where they think that all that contact stuff, it might go away by this summer, so that you might be able to share a little bit more. I reached out to our ropes course and they told us, if you just Lysol, it really won't affect your ropes equipment that much. So that's what we're going to do. And we've already done that at the end of the day anyway. So we might have to do it a little bit more, but they said you shouldn't really have to worry about it. It shouldn't really wear down your equipment too much.
Any other questions or comments regarding staff interactions?
I think I shared a little bit. We're really kind of going into the pod idea of really sequestering staff that are going to be here all summer. I mean, we typically have done 6 sessions of summer camp, and each session has a whole group of 70 staff volunteers that come in and come out with them. We were changing that and actually going to hire for the month. We were actually going to train and quarantine them beforehand, also to train them through activities and all that. And they were going to then be the constant up there as kids left for different weeks. We felt most comfortable with that with regards to being able to control that. And as I said, staff would be more kind of utilitarian players. We had talked a little bit about lifeguards being yes, but there's some distance things there. Also having individual times for groups to go to the pool rather than sharing times. We've also talked about, eating and actually creating those pavilions. And we'd actually take on extra staff that would basically be delivering meals out to cabins. They would have a family meal, which we used to do in the dining hall, and then bring it back. And that would just become a regular cadence over the 6 days.
At Ugent Trillium, for staff-wise, our plan is to have about 40 staff at each site. We'll bring them in at the beginning of the summer, and they'll be with us through to the end. At this time, we're planning on not having them leave for days off, because our sessions are structured the way that they're going to be, which is 5 days on, 3 days off. That will be their time off in between those breaks, the breaks in between. So that's been an interesting one that we've been trying to navigate and figure out is that days off piece, and what we're allowed to do and what staff will want to sign up to do. And so I think that's the direction that we're going right now, and we're just beginning the process of our recruitment.
One other question I think that can tie in, we're talking about the upgrades and the cost for upgrades. And I also kind of want to tie in a little bit about the requirements for PPE. Are you as host facilities providing the PPE, not just for necessarily your own staff, but possibly for people coming in that are renting, whether it be your own individual camps or renters? And then also looking, because one of the questions in the chat was as far as where did the funding come from? Grants, whatever, fundraising for all these upgrades, and possibly even then for potential PPE. If anyone has or anyone would like to jump in on that.
Matt, I can jump in quickly with camp. So as part of our budget, we have an annual deferred maintenance line for our property, and we would use our deferred maintenance line to pay for any facility upgrades that we need to that fit within that budget. as far as PPP goes and what they're required, we're writing right into our contracts that with our renters that they are required to purchase those and bring them with them. I think the only area that will provide some level of protective things is our kitchen, which we provided gloves anyway and things like that in our kitchen facilities. We may continue to do that, but otherwise it is the renter's responsibility to bring those materials with them.
Yeah, and I would agree with Dennis. I think that, contracts and taking a look at having those conversations of who's going to handle what, who's providing what is really important. I know, in taking a look at what the increased cost of staff and people and those kind of things, I mean, we were prepared, and we also had conversations with certain donors and foundations of what we were trying to do. They were, we got a fairly positive response that they were willing to support that. Knowing that we were going to try to do that and go forward. So it's just kind of being creative that way, but also letting parents and those kind of things know up front if they're supplying masks. We were actually asking them to bring a number of masks just so that they would have, so each camper would have spares, what kinds of masks, washable, those kind of things, so that so that we could ask for their partnership in providing this experience for their kids. Is what we're looking for with regards to PPE and that kind of thing.
Any other comments, questions? All right, there's still a few more questions in the chat that I definitely want to get to. For the groups that, this is an interesting question that came through. We talk about possibly not running our own sessions, but providing rental facilities. Has anyone received any pushback or any concerns from families in regards to having these other sessions, but not actually having camp, or any, pushback from donors for the same respect? Or the idea of having fundraisers but not having your camp? Is there anything that's come up for anyone in the group?
So the camp we rent from, they gave us specific dates because they have a 8-week time frame where there's no outside people coming in, because they also rent to other outside people like us, for example. So we were given last June, actually, either the first week in June or the last week in August, because they run all their own camps in between those days. So that's just the rules that they have to follow with the association and all those other things, and ACA and all that. So that's how they're limiting that outside, I guess, contact with their campers. So we're kind of the outsiders, and they keep their campers on the inside. So.
Has anybody else occurred any issues with families or donors? Make any pushback with as far as not running your camp but still continuing to fundraise, or if you own your site, renting it out?
Matt, this is Dennis. I can jump in quickly. In 2020, we were very clear that if our children couldn't be on our property, no one would be on our property, and we kept it that way in 2020. For 2021, we got out ahead of it and said, the CDC has said at-risk children can't be on our property, so our children can't be here, but we will begin to rent to others. And we did not receive, or haven't yet received, pushback or questions about that at this point. But I've been pretty open and transparent about that, because the CDC is very clear about our population not being able to come together safely. And because of our relationship with the hospital, they are crystal clear about us not being able to come together with our at-risk children. So no, our donors and our families don't really question it. Our families actually questioned more on why would you come together with them than anything else. So as Dr. Holman shared at the medical town, or Dr. Holman's is our connection at the hospital, and he shared that openly at the town hall a couple of weeks ago there in the chat. So
Thank you, Dennis. Another question I'll pose to the group as far as whether you're renting your site to other folks or you're having your own camps come into your site, what are your requirements as far as testing or as far as vaccinations for staff? What is that looking like for y'all? And on top of that, who's covering the cost?
So I can speak on this because we actually just settled this this afternoon. Well, for one, we are requiring medical staff and volunteers to be vaccinated. We also have about 20 paid counselors that we are not requiring because they're largely 18 to 22 healthy kids, and we just don't think it's reasonable that they're going to get the vaccine by then. But for testing, so we're working with a company, it's called Diligent, but it's in New Jersey only, I think, but a lot of more companies have sprouted up like this. They're charging us $1,000 flat rate, and they're coming out to camp 9 different times to do testing, PCR testing. And so what they do is they charge it to the campers and the staff's insurance companies, but that deductible is covered by the CARES Act. So the families themselves don't have to pay anything for the service at all. It's all deductible. If they're on Medicaid, the company that we use, Diligent, is automatically applying through the CARES Act on behalf of the family. So nobody's going to have to pay out of pocket. Camp just pays a $1,000 flat rate. We have international staff coming, and we just had to pay $100 for each of their tests because they're not covered by American insurance companies. But so, I mean, it's super. I think we're going to have 1,200 tests for $1,000, which in 2020 would have cost us $120,000 probably. So and a lot of companies are sprouting off like that. The CARES Act made it so that they can make money while people don't have to be charged. So it's currently a profitable business model.
And as far as vaccination requirements, Ryan, as far as your staff is concerned?
So we're not requiring them.
Okay.
But I actually, we just spoke with our lawyer yesterday, and he told us that you can require vaccinations. He said it's not entirely ethical because most hospitals aren't even requiring it for their staff right now, because it's just like Michelle pointed out, because it's emergency use and hasn't even really been cleared yet. It's only been cleared for emergency use, I should say. So it's a kind of a gray area. Since we do both paid and volunteer, we're just saying volunteers have to get it and paid counselors don't.
Okay. Any other questions? Feel free. Again, you can either put them in the chat or you can just unmute yourself and shout out your questions as well.
I was just going to respond. I know Michelle just put in, and understanding that we cannot legally require anybody to be vaccinated since it's an emergency vaccination only. I think that is, I've heard that debate with regards to employees. Volunteers are separate. Volunteers, we can do that, but with employees, it might be a tad different. There's a lot of kind of dancing around with regards to that. So it's not fully settled from at least our legal counsel on whether or not if we can do that for employees or not. But that just might be our legal counsel.
I can tell you, I mean, whether you care or not, because we're in Ontario, so it doesn't, it's not really the same laws and state mandates, but the numbers are, to my knowledge anyway, quite different here than they are in many parts of the US. And so from that end, that may sort of dictate our approach in terms of testing. We're still figuring that out, and our medical advisory committee is going to guide us on that. And on the vaccine piece, we're much slower to the vaccines here in Canada than you are in the States. So it's not even going to be an option, I think, in many cases. Maybe our medical teams will be vaccinated by then, but certainly vaccines won't be going into the arms of any of our staff at that point, I can't imagine.
Okay,
This
so
is Dr. Kate. Question for those of you that are going to be doing your camps or running your facilities. Has there been any effect on your insurance, or have you needed to change how much coverage you carry or anything like that?
This is Brian. I know that we've had deep conversations with risk management, and we're currently dealing with and getting counsel with regards to legal. But I know that there's no real taking a look at increase of rates. There are strong recommendations having to do with a couple of issues. Number one would be force majeure, especially being a business that if all of a sudden we got closed down and we had to cover costs, could we do that onto campers, onto a rental group, keeping deposits and doing all that, that we wanted to really look at that, our language in our contracts or agreements with regards to, you know, and this would go if we had a fire, which gosh only knows we have in Southern California all the time, but also if there is authorities that say that we can't operate and we've made agreements, what kind of, and we actually incurred expenses planning for that, would those be, you know, recoverable or not? So that was one of the things that we're exploring. The other had to do with waivers, because technically waivers and liability, I mean, that has to do with negligence. And so it gets really touchy on how you do that with regards to COVID. So a lot of the strong recommendations, and we're trying to take a look at crafting that, really has to do with more having a consensual understanding between campers and the camp, saying, hey, this is COVID. We can't guarantee, we're doing certain things and you don't have to come, but we're doing all we can, but we can't guarantee that you're not going to get it, with the idea that that will be at least viewed legally as a view of, you assume that risk rather than going back and assuming that the camp did something incorrectly or negligent, if they followed certain guidelines that we were able to define, and we were following those. So some of that legalese, and that would also be with rental groups as well. We're also finding out that even with rental groups, we might have to ask groups, our renters, to actually have their families also sign some statements of consent, not just the organization, but the actual individual, the parents of, if it's an underage camper or an adult, and staff and everything else as well. So those are some of those kind of legal hoops that we're trying to get worked out right now, making sure that we're being respectful, we're being understanding, but we're covering the organization from excessive liability.
So, Kay, this is Jennifer from Make a Dream in Montana. We own our facility, and at least in 2020, not only did we not save $1 on our liability coverage for the year, even though we had 0 participants or anyone on campus the whole year, we were required to also add a policy to our insurance last year, liability-wise, to cover our virtual programming. And so our insurance actually went up last year by not doing any in-person programming. We don't know yet in 2021 exactly what that's going to be, but we should find out soon, and don't really anticipate that we will probably save anything this year either.
This is Dennis with Camp Tecumta. We were one of the lucky camps that was told by Markel that they were no longer going to cover us, and our insurance ended in December. And so we went out to bid and collected a bunch of different quotes. And every quote that we received with additional COVID related riders and things was $10K more than what we've been paying with Markel. The cheapest one was $10K more. So for those of you that might be losing your insurance with Markel, just be aware that you may find the same thing that we did, but we are now paying about $10,000 more. And similar to what Jennifer, you were just saying, we had to add coverage for web-based programs or internet-based programs, as well as crime connected to web-based programs. We had to add in as part of our coverage, and we didn't save a dime, even though we had nothing in person. And again, this year, we're having nothing in person, and we've gone back to them and said, look, we're not doing anything in person. Can we save? And they have not answered that question yet, just so you know.
We even had to pay our professional liability coverage for our volunteer medical staff who did nothing for us.
Us too. And that cost went up as well. I don't know about yours, but that cost went up as well. But we landed with Redwoods, who I think is a fantastic company, and they're offering us so much more than Markel ever did. We're very pleased with our new company, and even to the degree of their best practices library and collecting copies of what they're requiring renters to sign. They have this enormous best practices library that we are drawing from to create a lot of our forms. Because if there's going to be a claim, it's going through them. So we might as well use their information, kind of thing. So, and we felt very good about that. Not good about the 10K increase, but good about everything else, just to be clear.
It's a little bit of a balancing, right? You know, we look at the positive with every negative that we find.
Yeah, for sure. I mean, one of the nice things that Redwood has is the Redwoods Institute. So they have online trainings for our staff with sexual abuse awareness and things like that. And we were looking at purchasing software programs and online programs to do that. And now we don't have to purchase it. It's coming as part of the cost of our insurance, which is kind of nice.
Other questions from the group? A few more moments, 3 more minutes to chat. If there's any other questions that have come up, or if we missed something in the chat, please let us know.
So I would just add real quick, if you do decide to open camp and you are going to sign a contract, read the contract a lot more carefully this year than you probably normally do, because I know we've been sending out the same contracts for 20 years. And now because of last year, we had our lawyer completely rewrite the contract. And, fortunately for us, unfortunately for rental groups, it's definitely leaned a little more in our favor as far as when the cancellations policies are. When the rental group would have to cancel, when we would have to cancel, when deposits are due, when we get our payments, that sort of thing. And a lot more clauses that would allow us out of our contracts a little easier now that we're out of the pandemic. So definitely read your contracts a little more, because I know a lot of camps are going to be making it a little more in their favor to protect themselves in the future.
Katie with Camp here in North Carolina. I have a question. If you are planning to have sessions, have you thought about what information you're going to be sending out to parents as far as your protocols, your cleaning policies? I would imagine, of course, the generic HVAC updates. But I also remember in a COCA session, one speaker speaking to the fact that they were planning to send their entire cleaning process down to what products were used on what surfaces. So I'd love to hear more if anyone had thought through their plans for that.
Great question.
It's funny, I just tried to make a kind of COVID-19 addendum that we can send that would be more of a summary that we can send to our parents. And I think our original policies are 12 pages and my addendum ended up being 10 pages. So I don't really know how much I cut, but I didn't get into the minutia of what type of things we were using to clean and all that. But I tried to say what's important, and then it turned out that it was pretty much all important. So I just went through the field guide and just kind of whatever the field guide said. It always gives you like best practice, good practice, better, something, some verbiage like that. And we made our policies around that, and then we're going to send our policies. The tricky part is going to be when we send those. I think we'll probably send them in late May, with camp starting July 3rd, because we want to wait as long as possible so we can send the most up-to-date information while also giving them time to prepare, since it is going to be so different. And somebody did ask the question about how much more are you cleaning and all that. So since we own our own facility, it was funny, me and our executive actually looked at each other and said, we're not really cleaning much more differently. I mean, we're getting spray guns this year, so it's going to look like we're cleaning a lot more differently. But because we have so many kids on active treatment, everything that ACA is telling you to do and the state's going to tell you to do, we were already doing, because our kids were more susceptible to things, to communicable diseases anyway. So your rental camps really shouldn't have to change that much with how they clean, because they should have pretty much been cleaning for all of us this way anyway, if that makes sense.
I have a question around the sprayers. You know, we're seeing some conflicting opinions here in Canada around the use of those. Was that something that was mandated by the ACA and their field guide for you, or was that like an above and beyond approach that you're taking? So we're talking the electrostatic sprayers.
Yeah, great question, Colin. So we got it early on when they were like the hot topic thing, and probably now I really wouldn't get it. And it's funny, we got it, and then the very next week, one of the models that we bought was recalled because they blow up in people's hands. So hopefully that's going to get fixed before the summer. But really, I think it's a big optics thing more than anything. It's like kind of a security screen, but you know, just cans work. If I can go back, we would just do cans. I think we got caught up in how cool it looks to be holding like a flamethrower of disinfectant on our playground.
You'll have something for future all camp games in summers where there's not a pandemic, Ghostbuster material or something like that.
Any other questions, comments? Anything left from the panelists? If there's anything that you think you'd like to offer up, anything that we may not have considered or thought about, that, you know, as a owner of a facility, something that, you know, is at the forefront of your thinking?
I just wanted to point out some other things in the chat. There was a question about social distancing in the cabins. I know the ACA field guide addresses how you consider your cabin group. And there's also a question about, you know, swim instructors and swimming. I know that was, you know, one of the first things I thought of with camp is how do you keep all those little kids away from one another in a pool, you know? So I was just wanting to know if anybody would like to comment on those two things.
Well, I could just jump in and say that we're really taking a look at cabins and families being a cohort. So therefore, a cabin having their own experience, we were creatively taking a look at all camp experiences that would create social distancing from those cohorts. But if they were inside that cohort with masks, if they went outside, they'd have to wear one. In cabins, not. With the pool, matter of fact, I responded to Michelle. With that, we were just going recreational swim rather than swim instruction. It would be by one cohort group at a time. So there wouldn't be multiples coming in, because that cross contamination or the opportunity for that would be hard to track. Well, you could still track it, but it would still be increasing risk. So we were really looking at how to make that experience as a cabin group rather than like a group of cabin groups of a whole camp? And how do we isolate that to kind of solve some of those social distancing and safety issues?
All right. If there are no other questions or comments, I'll just take this opportunity to again thank Ryan and Brian, Colin and Dennis for being on with us tonight and offering your expertise and your experience working with your host sites, your sites that you own. But I thank you all so much for being a part of tonight. As far as all of our participants, thank you so much for coming on tonight. We hope your questions were answered. If you have other questions, please don't let this conversation stop here. There is always opportunities to have further discussions. We do have a few sessions coming up. So up on your screen, you'll notice next Tuesday is our first medical town hall COVID and vaccine update with Dr. Rafi, our infectious disease clinician, and Dr. K will be on that call. So that's Tuesday, March 2nd. March 10th, we're back to Wednesdays. We will have COCA-I game night, Dutch auction with our host Knuckles from Camp Okaizu. For those who know Knuckles, he'll be hosting our game night. And then it's Come and Get Crafty on March 24th. So myself, as well as my good friend Deanna Slade, she will be on with us, and we will be doing some crafts. We'll be sending out shopping lists for all those who want to participate. And again, on Tuesday, March 30th, please mark your calendar. We were very fortunate to have Patrick Hardy from the Hytropy, hope I pronounced that correctly, Hytropy Disaster Management. He's the founder and CEO. So he'll be doing a Prepare Your Camp for Disaster in 5 Easy Steps webinar. On that will be again March 30th. All of these can be found on our outsidethebox.cocai.org website. Plus, you'll also get plenty of emails reminding you. So please feel free to register for all of them. But definitely come to the craft one, but come to all of them. And again, we'll be doing some other fun stuff coming up in the near future, some staff training. What does that look like for 2021? We'll be having some networking social hours for our members, as well as virtual game and activities, some board development, and there's so much more. So if you have any questions, concerns, comments, please email Jennifer. Her email address is on the screen, but it's also on the website. That's how we connect those two. So please feel free to reach out to her or any of us. And we just, again, really appreciate everything that y'all are doing for your kids, whether it's virtual or in person or a hybrid. We greatly appreciate all that you do each and every year for the kids, as well as your staff and families. So again, thank you all so much for being here tonight. We look forward to the next time that we could all be together. So thank you all so much. Have a great, great evening. As always, stay positive, test negative.
It might seem